With me now, Dr. Yasmin Maor. She is the head of the infectious disease unit at Wolfson Medical Center. Doctor, thanks for being with me. You know, we've had Omicron cases now confirmed, known for a month. It's quite clear it's really contagious. It spreads really fast. But is it more dangerous than Delta? Is this going to make vaccinated people more sick than Delta?
Well, the preliminary information we have from South Africa, it might be that perhaps this virus is less severe than the Delta. But I'm saying this very cautiously because the data is very difficult to interpret, and also the background level of illness in South Africa and their vaccination program is very different from Israel. And data from the UK are still shaky. It's very early there. So we really don't know. But what I really want to stress that even if we are lucky and this variant may be a little bit less severe than the Delta variant, because it's so contagious, we're going to have so many positive patients, but eventually the number of severe people might be extremely high, even if the variant itself is less severe.
Doctor,
and also,
can I ask, do you think we're talking about how
very quickly?
Go ahead.
I just wanted to say that since the contagiousness is going up very quickly, so we might have a cluster of very severe patients, even if the virus is less severe.
Doctor, on that point, how contagious this is, many experts who spend their lives in virology and infectious diseases are shocked to see how quickly this is replicating. Are you shocked? And do you actually think perhaps everyone in Israel, every person, perhaps could be exposed to Omicron in the next few weeks?
Yes, I think this is definitely a scenario that we were very worried about. And when we are talking about such wide exposure, so you understand our stress regarding the burden on the healthcare system. I still want to stress it's very radical that the virus has such a quick spread. We know from the literature that diseases like measles and also varicella may be extremely contagious, but these diseases are now controlled by vaccination, so we don't see such outbreaks anymore. So this is really very alarming.
Is it wrong to assume or to think that because this virus is so much more contagious, it is therefore less, lethal? That there was a substitute for transmissibility and contagion in regard, you substitute that in exchange for severity.
It may be the case, but not necessarily. We can also see a virus which is very contagious and also very damaging. So the only thing that we can now hold on to is data that we are seeing from other countries where the Omicron started before Israel, or the rise started beforehand. And in this respect, the best data we can get at the moment is from South Africa. But as I said before, it's very difficult to interpret because South Africa is so different from Israel regarding the population, the healthcare system, the vaccination program, and so forth.
Do you think that a lockdown may be warranted, perhaps limiting gatherings, perhaps considering, limiting in-person school once again? Or is this so contagious, Doctor, perhaps it'll burn so fast it may actually be too late, of limited value?
I think it's still too early to judge. And at this point of time, I think we need to do maximum efforts to try and slow down the spread of the Omicron. I don't think we can stop the spread. I don't think that we can really change the number of patients that will be exposed eventually. But if we manage to make the graph a little bit lower and straighter, then we will be able to manage the number of very sick patients that we have. And one of the reasons we want to buy this time is hopefully that people who still haven't received the first booster dose and children who are not yet vaccinated, this is really their last opportunity to go and get vaccinated and protect themselves. And I want to stress here again that, for the serious patients, when you get very ill, we really have very little to offer these patients, and it's rather a matter of luck if the way they go through this disease.
Dr. Yasmin Maor with Wolfson Medical Center, thanks so much for your expertise and weighing in on this topic tonight with us on I-24 News. Great to have you.
Thank you.